deep tissue. Yeah? Lower limb deep tissue. We start from the back of the hip, and we'll do the back of the hip, we'll do the side of the hip, hamstring, iliotibial band, calf muscles, and then we turn and we'll do the quadriceps in front, and probably that's it. Okay, so in terms of draping, you need to release the towel underneath. Yeah, and then you may need to lift this towel a little bit. Yeah. Good. Holding it in two places. Before that, taking the leg a little bit to the side. Holding it in two places. Draping that way. And then draping the towel. Yeah? Do you want me to show you again, or it's okay? Yeah? All right. It would be nice to start with whole body, whole limb, effleurage. What I'm going to do is, at time, I've watched you when you did the exams video, and I've seen that you're not using enough your lower back, sorry, your lower body. So at time, what I'll ask you is to break contact and do it just by yourself, just like that, and then re-engage. It will just remind you the importance of.
Was our exams video?
No. Yeah. While doing massage, I would start feeling okay. I would start feeling tension, definitely the calf muscles, yeah, and also on the hip, you would feel tension. Okay. Then I would start doing Petrissage locally here, legs, and Petrissage onto the gluteal area. Yeah. So in terms of Petrissage, come maybe around this side, so we can see when it comes to Petrissage on the onto the gluteus area. Yeah. You can do it with your. First of all, you can come onto the other side. Yeah. Once you do the other side, it's a lot comfortable because your hands are just in the right position to do that. Again, do move, yeah? Good. From here, we're not going to do it now, but you can go on to do the... What's that? Where? Yes, iliotibial band, which in many ways, it's a continuation. From Gluteus Maximus, it continues to the iliotibial band. Okay, you can use the back of the heel. Until you feel a bony landmark here. Yes, this is the femur. Yeah, the side of the femur. You can do fist, and just turning the fist, or even the knuckles. Yeah? But here comes that you want to do something even deeper. And for that, you can use your forearms. oops, sorry. You can use the forearms, and if needed, then you can move on to the elbow.
Yeah, that's what they like. It's a trap now.
Now, do not attempt to work deep and then move your elbow. Yeah?
Do you feel like quite a few clients are a bit like hesitant for you to go into those areas?
Not really. Not really.
So do you stay still now or do you move actually?
I don't move. I get in,
Just apply for
out, and then move.
So are you using elbow there?
Elbow, yeah.
To get into a...
Yeah.
So we've done that with the wrist, but now we're just doing it with the elbow.
I would just do it with the elbow, yeah. Right. The location. Where do you do that? You will need to do that onto the side of the sacrum and try to get into the bony attachment. So sacrum around here and the femur. What you can also do is introduce some movement into there and do it when you're using movement. It's one way of sort of distracting this bit.
Are you pushing hard or
Sorry?
how hard are you pushing?
Medium.
Medium.
Is it very hard?
No, it's just about right.
No.
Why are you doing that? What are you doing there?
The muscles here, when you do that movement, the muscles get stretch and relax, stretch and relax. So it's almost like a distraction for these muscles to be worked on with changing their not angle but the length. Okay. Coming on to the thigh muscles, to the hamstring, you can do quite a lot of Petrissage. And then, if needed, you can still do the forearms. But most of the time I find that the hamstring are quite, if they have strain, it's quite superficial and you don't need to go very, very deep. But if you need, then that's what you can do. Yeah? Going to the forearm. It's quite the same as with the back. And then you move a little bit. Okay. What really most times need is the iliotibial band. And what do? You need to take the leg, push it a little bit to the side, and then drape around it like that. Yeah? And then the iliotibial band comes your way. So it's on the side of it. And that, you felt the twitch? I was quite superficial. So let's now warm this up. You can do that only with your palm, as it is. You can do it coming from the other side also. You need at times to hold that area because it will be quite floppy sometimes.
You got it.
Yeah. So then you can stay there for a little while.
Do you generally ask them where their pressure points are, or do you just...
At that time I felt, I felt the response.
Yeah.
And then, not that it needs in today, in working now, but you can do knuckles. And in some extreme, some extreme you need even the forearm. I'm just going to show you how. It doesn't need now. Again, moving your legs. And then you can go quite all the way to Gluteus Maximus. Yeah?
This is Sheridan's nightmare.
Now, some people, if they have quite big lordosis, if you do that, it will increase the lordosis. So it might not be great for them because it will be too painful on the lower back. Yeah?
Can you put like a pillow or something under there?
No, it's not that problem. The problem is that the arch. Yeah. Good. Continuing working on the deep tissue with the gastroc and soleus. Yeah. It's nice to work on the attachment, so you work around the knee.
I thought you avoided that area.
On the side, you're right. I avoid right in here. Do you see that?
Yeah.
Yes. This is called Popliteal area. And that's where a lot of the lymph nodes are and some of the nerves and arteries. But if you work on the side, is okay. Yeah, but I mean, I can work in here, but do not work deeply. Yeah? I mean, how does it sound? How does it feel?
Nice with the superficial.
Yeah. If you go deep, it's just, there is no muscles. It goes directly to the back of the knee. Yeah? Then, you can work with, you know, it's some of the no hands technique in which what you do, you can actually do Petrissage with the forearms. Yeah, you can do it this way, or you can do it that way. Yeah. Another really nice way to work, which we've all learned, is to do some of the jostling.
Oh, yeah. Yeah, they're like that.
I love it. Yeah. My client last week, I just let go, and the leg was still up.
Yeah. Okay. And then come and put the legs in here. You can add forearms. A lot of the time on these muscles, they're not very tense, so you can work by itself. But if you need, I would never use forearm here. It's just, sorry, elbow. It just doesn't need this place, yeah? Strength thing. So, on the gluteal area, you can work also on the towel. If clients, you feel that they are not open to, it's maybe the first time, you need to give them a bit more time to be on your side, so do it.
Not hygienic.
Or you can do it with the base of your wrist. Sometimes changing the position, so you're pushing it down a little bit. And by actually doing that, you're stretching the lower back. Still on the gluteus, you can fold the towel that way and come and do the draping a bit lower. Where is the oil? Thank you. And then you can do that on the top or the upper part of Gluteus Maximus. Yeah? Gluteus Maximus coming to Quadratus Lumborum. Now, a treatment for a lower back, when it comes to treatment of that area, I would prefer actually to do the forearm going uphill. Why? Because it would stretch it even further. Yeah? So I prefer to have my forearm starting from here now somewhere I'm jumping over the iliac crest. Good. After that, funnily enough, is amazingly to work on the sacrum itself. You just put knuckles. And probably the reason is that the sacrum has a lot of the attachment from all the muscles around. And then on the edge of the sacrum, remember that it's really nice to work on the edge of the muscles to bone. So try not only to work on the muscles, but on the attachment. You can't see anything, it's just the sensation of the sacrum when it ends and the muscle. Good. Then you can do, for the end of it, you can do a really nice stretch to the lower back. You can do even sometimes stretch side to side. You know, that side. It's quite actually it's quite hard because of the position. So you do one side and then the other side. Good. What else you can do for that area? You can do the topopment. The pounding really works in here, especially nice on the sacrum.
Doesn't that hurt, no?
Sorry?
Doesn't that hurt?
No.
What are you doing
like
then?
It's like getting a deep vibration into the deeper muscles. You know, some ligaments in the front of the sacrum, we can't reach everywhere. So if you send these vibrations, actually it's quite relaxing if you do it nicely. Yeah? Yeah? Now, topopment at times, it can be quite stimulating. If you have a client that didn't use much of the leg, you can stimulate it. But if you do it light and longer, it will be quite relaxing. So it's one of the techniques that is either stimulating or relaxing, depends on how do you do it.
I think it would be more relaxing on top of the towel as well.
Oh yeah.
Stimulating would be underneath the towel.
I rarely would do it on the skin itself.
Unless it's a very stimulating
Yeah.
massage.
Could be probably. Questions, comments?
That technique you're doing around the buttocks, when would you do that? Do you do that in a general massage or something specific?
I don't do general massage.
Full body.
I don't do full
As
body.
in specific to the client.
People come in with specific issues and then I do. Yeah. But if you would have someone who say full body massage, you do it. You do that. How do you feel? I mean, do you do buttocks and? Yeah.
Depends. But mostly it's always on anyone that will be the tighter area, like the back and the glutes. That's the,
But it's specifically for lower back issues.
Yeah, definitely. Lower back, I will always look at that. I would always look at the iliotibial band. I would use a tight hamstring. Because a lot of the time what I see is people, you you tell them they have come in with lower back pain, and they ask them to bend, and what they do is they bend from the lower back. The hip is frozen. All that area is frozen, and what it works is the lower back. And they're thinking, well, actually, it makes sense that the back would be in pain, and the hip would not be in pain, because the hip is frozen. They can't feel how they can move the hip. And they move their lower back. And sometimes it's amazing to see some youngster, they're wearing their jeans so tight, they can't move their hip. So what it moves is the lower back. And especially when we're sitting, the hip is frozen. So you're sitting and reaching here and there, and then you develop lower back pain. But actually, a lot of it is not where the pain is, but where the problem is. And the problem can be in the area that does not move. It's not painful that it does not move, as long as you not start to poking and touching, and then they feel that actually those muscles might be a lot more painful in the treatment, but gives a good relief, and then the lower back pain may even reduce without touching the lower back.
So for people also that come in with, I've had one or two people that are, I think it's to do with the sort of seasonal change, that pain down there and down there, and do you work on that area, or might that be trapped up here?
I try everything. I can't say I work. There is no...
I know you would automatically work on it, but it may be that the problem is actually from here, and it's
No,
causing
it
the
could
tension
be.
there?
It could be. It could be, yes. It could be that the iliotibial band send more like a trigger point, and then you have more referred pain. Should we start?
Yeah.
Good.